Hello and welcome. Today, we're diving into a condition that affects the urinary system, bladder trabeculation. We'll explore what it is, what causes it, and how it's managed. Understanding bladder trabeculation can help you better understand your own urinary health. Bladder trabeculation primarily occurs due to long-standing obstruction of the bladder outlet. The most common cause is benign prostatic hyperplasia, or BPH in men, where an enlarged prostate gland constricts the urethra. Other potential causes include urethral strictures, which are narrowings of the urethra, neurogenic bladder, where nerve damage affects bladder function, and bladder neck contracture, a scarring or tightening of the bladder outlet. Less common causes can involve congenital abnormalities present at birth. The pathophysiology of bladder trabeculation is a response to increased pressure within the bladder. When the bladder struggles to empty properly due to an obstruction, the detrusor muscle, which is responsible for bladder contraction, has to work harder. Over time, this increased effort leads to hypertrophy, or thickening, of the muscle. This thickening manifests as ridges, or trabeculae, on the inner surface of the bladder. The bladder wall can also weaken between these trabecula, leading to the formation of small pouches called diverticula. Ultimately, the bladder's capacity to store urine effectively is compromised, and the efficiency of emptying is reduced. Bladder trabeculation is strongly correlated with the underlying causes of bladder outlet obstruction. Due to the prevalence of benign prostatic hyperplasia, it is more common in older men. Statistics regarding the isolated prevalence of trabeculation are difficult to ascertain, as it is typically identified during investigation for lower urinary tract symptoms. The risk increases with age, and is higher in individuals with conditions such as diabetes or neurological disorders that can contribute to bladder dysfunction. The signs and symptoms of bladder trabeculation are often subtle at first, but can progress over time. Common symptoms include increased urinary frequency, especially at night, known as nocturia, urgency, a sudden and compelling need to urinate, hesitancy, difficulty starting the urine stream, a weak urine stream, a feeling of incomplete bladder emptying, and sometimes urge incontinence or involuntary urine leakage due to the sudden urge to urinate. In severe cases, urinary retention, the inability to empty the bladder at all, can occur. Diagnosing bladder trabeculation typically involves a combination of medical history, physical examination, and diagnostic tests. A thorough medical history helps to identify potential risk factors and contributing conditions. A digital rectal exam may be performed on men to assess the size and consistency of the prostate gland. A urinalysis can rule out infection or other underlying issues. Post-void residual measurement assesses how much urine remains in the bladder after urination. Uroflowmetry measures the rate and volume of urine flow. Cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder wall and confirmation of the trabeculation. Ultrasound or CT scans may also be used to assess the bladder and upper urinary tracts. Bladder trabeculation itself doesn't have distinct classifications or types. Its severity is generally graded based on the degree of trabeculation seen during cystoscopy. The focus, however, remains on identifying and addressing the underlying cause of the bladder outlet obstruction. Treatment and management strategies focus on addressing the underlying cause and relieving symptoms. For BPH, treatment options include medications such as alpha blockers and alpha reductase inhibitors, which can help relax the prostate or reduce its size. Minimally invasive procedures, such as transurethral resection of the prostate or TURP, or laser prostatectomy, may be necessary to remove obstructing prostate tissue. For urethral strictures, treatment may involve dilation or surgical reconstruction of the urethra. Intermittent catheterization may be necessary to help the bladder empty fully. Lifestyle modifications such as timed voiding, fluid management, and pelvic floor exercises can also help manage symptoms. In cases of neurogenic bladder, medications, botulinum toxin injections, or neuromodulation therapies may be considered. While it may not always be possible to completely prevent bladder trabeculation, managing the risk factors and underlying conditions can significantly reduce the likelihood of its development. Regular check-ups, especially for men over 50, can help detect and manage BH early. Maintaining a healthy lifestyle, managing diabetes and neurological conditions, and avoiding prolonged urinary retention can also help prevent bladder trabeculation. The prognosis for bladder trabeculation depends largely on the underlying cause and how effectively it can be treated. In many cases, addressing the underlying obstruction can improve bladder function and alleviate symptoms. However, if the condition is left untreated for a prolonged period, it can lead to irreversible damage to the bladder and kidneys. Recent research focuses on improving diagnostic techniques for earlier detection and developing less invasive surgical treatments for BPH and other causes of bladder outlet obstruction. There is also ongoing research into the use of regenerative medicine to repair damaged bladder tissue.